Covering everything you need to know about strokes. Today, focusing on the moment that you should start calling for help. Hannah Steele joins us to talk about the warning signs. She's a registered nurse with the Stroke Center at Moses Cone Hospital. Good morning.
Good morning.
So let's talk about some of the warning signs. I think a lot of people, we're aware of some of them, but you've got some that we really need to be aware of, and the moment that it becomes a problem, right?
Yes, so every 40 seconds in the United States, someone has a stroke. And those signs and symptoms are very important to note for your loved one or yourself if they're to all of a sudden come on. A lot of them include weakness. So on one side, a lot of people know the arm, but it can include the leg or be just the leg as well.
And this is one side?
One side normally, yes, it is on that one side. Some visual changes, so dizzy, blurred vision or blindness, normally in one visual field, some slurred speech, maybe some staggering gait. You notice that your family member is having to hold onto the walls, and that's not normal for them, as well as a facial droop. So noticing that their face is a little uneven. An easy way to remember this, and you may have heard of, is the acronym FAST. F is for your face. So you look at their face, is one side uneven. A is for the arm. You get them to hold their arms out. Does one side drift or have some weakness?
Okay.
S is for speech. Are they slurring their speech, or it's not normal, not what you normally hear them say? And T is time. Time is brain, so time is of the essence. And so if you have any of these symptoms, calling 911 immediately and seeking medical attention is important.
If you see them in yourself, it's one thing, but if you see them in somebody else and their first thing is to say, I'm fine, this will pass, how do you react to that? I mean, you know, time is of the essence in something like this.
I think ultimately what you have to do is you have to encourage people around you, and especially those who may not know the symptoms, and just speak the knowledge that you've been given. So I'm giving you this resource, and so then with those around you, speaking that same resource and being able to go in and speak like, hey, if you're having these symptoms, this is a really big, important thing. And I mean, stroke is important, and it's one of those things that time's of the essence, because what happens in a stroke is the blood flow is stopped to that particular part of the brain. And it only takes about 6 to 20 minutes for those brain cells to die. And so the longer you go without blood flow to that area, the brain can be damaged, and long-term damage where it cannot be reversed. So getting someone that medical attention is important so that we can ultimately help them. We found that most of our stroke patients have the best outcomes, those who are treated within 6 to 8 hours of that stroke.
So what about the driving them to an emergency room versus waiting on an ambulance? I guess it depends on the situation.
Yes, so particularly Cone Health is a stroke center, which means that the surrounding paramedics and ambulance service, they have been well trained in stroke because we work with them. So it is more important for you to call 911 and seek that ambulance
because they're going to be at your house quicker than you can make it to the stroke center.
They're going to be at there quicker, and they're also going to be able to go ahead and call us ahead of time. People don't realize that the ambulance service and the paramedics are able to go ahead and call us and let us know you're coming, so we can be well prepared for you when you walk through that door. See, at Cone Health we have a stroke team that's activated a lot of times from the paramedics. They'll call through, they'll activate the stroke team, so we meet that stroke patient at the door. We have a neurologist, a nurse practitioner, PA, as well as a nurse that meets them at the door, can evaluate the patient and decide the best treatment plan. At Cone we use 2 treatment plans, particularly right now in that quick amount of time. One of them is a clot busting medication that has to be given within 4.5 hours of the stroke being noticed. And then the other one is called a thrombectomy, which what it is a procedure where they actually go in manually and remove the clot. And 80 to 85% of patients, that's a successful procedure. So it's much better to go ahead and call the paramedics so they can call us, we can be prepared for you, and you're treated in less time.
That's the outcome we're looking for. Thank you so much. We appreciate it.
Absolutely.
Hey, if you want to learn more information about them, find out if you're at risk, check out conehealth.com/stroke. And if you need more information about stroke support groups in both Alamance, Guilford, and Rockingham counties, go to conehealth.com/classes.
House Call on Fox 8 is sponsored by Cone Health.